Dr. Chris Asandra, the smartest guy that I've ever been around in longevity, hormones, optimization.
They were taken off the market because I think they were just working so well. And it kind of scared, I think, a lot of the big pharma and a lot of the drug industry.
I'm getting ready for a movie. Big blockbuster movie. What stacks am I taking?
So, without mentioning names.
Well, what do you think about Ozempic then, that hot term?
Does it work? And is it safe?
Does it?
Yes and yes.
Okay. Yeah. It is safe.
But I will say we have better options.
All right, so let me shoot it to you straight. Ketone IQ has been an absolute game changer for me. Now, I used to think that I had my energy just dialed in, locked in. I'm up early at the gym, podcasting, recording, speaking, all this stuff. And, that life rhythm, right? But there were still dips. There's afternoon dips, moments where I'd hit a wall midday and I'd be like, yeah, I need a spark. And that's when I started using Ketone IQ. So it's not the, caffeine jittery high that you get with coffee and all of that. It's a whole new level. Focus, mental clarity. It's clean. It's a locked in feeling. And I take it before I podcast, before I go on stage to speak. I take it before my workouts too. And my body just, it responds better. I'm sharper. And I'm really big on, every single, thing that I do. I want to have the highest amount of focus, the highest amount of clarity. So for me, it's just become part of my routine is Ketone IQ. It's a non-negotiable for me. It's part of my rhythm. No crash, no nonsense, just real usable energy, and it just keeps me in the flow. So go to ketone.com/David and try it for yourself. That's ketone, ketone.com/David, DAVID. And trust me, you will feel the difference. Dr. Chris Asandra, one of my very good friends and one of the smartest guy that I've ever been around in longevity, hormones, optimization, you name it. This guy, he knows. I mean, you follow him on social media. Every picture is like, hey, this person started here and now they're incredibly healthy, jacked out of their mind. So yeah, there you go.
Yeah. Thanks for having me on, David. Really appreciate it, man.
Absolutely, man. I think we're at this day and age, with RFK leading the charge in health of, peptides, hormones, this kind of thing out there that people are like, ooh, what is it? It's been taken off the market, BPC 157, all of this. Can you give the audience just a breakdown of the benefits, efficacy of peptides, why
Sure.
that is something that is a good thing and will be going forward?
Yeah, I mean, kind of as you alluded to, they were taken off the market because I think they were just working so well. And it kind of scared, I think, a lot of the big pharma and a lot of the drug industry because people were getting better without, a lot of the side effects of drugs. And basically, peptides are just a chain of amino acids that signal the body to do something, whether it's heal your body, lose fat, increase blood circulation, help your gut heal, put on muscle. Stimulate growth hormone levels. I mean, there's so many peptides out there that you really need to focus on what the needs of the body are, and then you can just pick a specific one, and it will help with that. And a lot of times, they don't have the side effects of taking, these painkillers and other anti-inflammatories that really have other side effects that that aren't the best for a lot of people. And like you alluded to, like with RFK, I'm really excited because he's a big proponent of these types of treatments, and hopefully he can start, pass some regulation to help it, facilitate them coming back. And that's what's really exciting about it. And you combine that with, all the wellness that we have now and everything else. And I think it's going to revolutionize healthcare a lot. It already is for a lot of people that use it.
What do you think RFK's on? Is he on a stack? What do you think? I see him at Gold's Gym in Venice, and he's jacked. Let's just put it as
jacked. Well, again, I don't know exactly what he's on, but I'm just assuming that he's probably on a good peptide stack for his age. To have that much muscle mass, retain that much. I personally is obviously on some testosterone replacement. Don't quote me on that. I don't know for sure.
No, this is off the record, no quotes.
Yeah,
what would you guess?
I don't know
what
for sure. He's obviously not my patient, but he's definitely on some sort of hormone replacement therapy and probably some peptide therapy as well to maintain that body for his age and to be in such good physical, not just physical, mental shape as well. I think he's got to be taking something there. I mean, you don't see many guys his age looking like he does.
He does a lot of pull-ups. I don't think that's just it. You're right. What do you?
Anybody his age doing pull-ups? Yeah.
As far as peptides go, what's the best delivery mechanism for them?
Yeah, I think, well, it depends on the peptide, what the focus is. So most of them are injected, and they have to be injected almost daily to facilitate a response, whether it's stimulating your growth hormone levels, whether it's healing the body. Some can be taken orally, though, like if you need to heal your gut. BPC 157 is a great one that you can take orally, and it helps with acid reflux, repairing the gut health system, leaky gut. People tell me when they take it orally too, they do feel their joints feel a lot better. They don't feel sore when they take it. So, there's a lot of different delivery mechanisms, but I think the majority of them are taken by injections, and it's not painful. You just use a small little syringe and a little insulin needle, and you just you really get used to it after the first one, and people get over the needle phobia quite quickly.
Yeah, for sure. So, okay, peptides. Do you think BPC 157? Which other ones do you think of? Like, hey, I'm going to give somebody peptides. Let's say, let's just say longevity and becoming as aesthetically jacked as possible. What are you taking?
Well, I think CJC 1295, which stimulates growth hormone, is another great peptide. I think for women who are looking to improve not just women, men too, looking to improve collagen and wound healing, especially after surgery, or they just want to look younger and stimulate collagen and hair growth. Copper peptide, like GHK copper.
Wow.
It's like the element copper is a great one to use as well. It has to be cycled. But there's a whole bunch of different ones depending on what your goals are. Some are just purely for fat loss. Some, even this Ozempic craze and Mounjaro, Wegovy, Zepbound craze, those are technically peptides. So, those are technically peptides that you can use for, that's for weight loss and controlling diabetes. And they're starting to see it has a whole bunch of other, positive effects now too, including anti-inflammatory, helps with heart disease, kidney disease, Alzheimer's. There's a whole slew of things it's helping with.
So would you say, is it a healthy thing to take? Like Ozempic is kind of the thing. I know there's the other ones as well. Are people scared of it because it seems too good to be true? Are there side effects? What's your take?
There's definitely side effects. I think when you're on it, you got to make sure you're getting enough protein intake. You got to make sure you're hydrating well on it, getting your vitamins, I think the negative stigma comes around from it because, alcohol, you shouldn't drink alcohol if you can while you're on it, if you can avoid it. Because some people, you'll hear about the Ozempic face or people throwing up or they're, aspirating the contents of their stomach when they're going to surgery. I think any medication needs to be, really taken responsibly and under a doctor's supervision. So, it really needs to be followed well. And I think there is a negative stigma, but I think honestly, if you're doing microdosing or if you're kind of on a maintenance dose, I think the benefits outweigh the risk a lot of times with these newer, GLP peptides that are out there.
Yeah. You know what? Can I rewind a second to, you mentioned copper, and it came across my mind because I talked to another really, really smart doctor, Dr. James, big on social media, and he was talking about copper of being, one of these ones that people don't really think about, but actually is a game changer. Why is that? What is in it? What's it doing?
It's basically the copper element. And what we found is it can really help with repairing wounds and stimulate collagen. And collagen is like the building blocks for our skin, our tissue, soft tissue repair, et cetera, and our hair. They're even injected into the hair sometimes to stimulate hair growth. But it's one of those that we really are finding that if it can stimulate protein synthesis and collagen, who doesn't want to have that? It's a very, very potent peptide for that and element for that. So a lot of people are starting to do it now after surgery, so their wounds heal better, their scars heal quicker, et cetera. We're seeing really positive results with that, and along with other peptides too, like BPC 157 pre and post surgery are great peptides for that.
What are we doing? Maybe we start a copper supplement company.
Well, they actually have like the copper face creams. They put it in face creams now. I don't know if they really have an oral version of it because I think it just gets pretty much destroyed by the liver once you eat it. But injectables is really the way to go. I think injecting it, daily for a certain amount of time is really the best way to take it. But it's kind of one of those things that are up and coming,
Speaking of injectables, TRT, I think a lot of people understand TRT. They look at people that are in, older, the RFK look, maybe that is, maybe that's not. What talk to us about TRT. Is it, because there's two schools of thought, right? It's like, hey, I don't want to get on anything because I become dependent on it. Is that something that becomes dependent? Is it used in special situations, cycled? What's the best way to use TRT?
So I think we need to break that stigma of, you're using steroids and you're doing it to body build and that's the reason why you hear about people. I get that question all the time. Do I have to cycle this? And if you're on testosterone replacement therapy, I don't believe you need to cycle it because you're not doing the massive doses that bodybuilders are using, or people that are trying to change their physique rapidly, and they can only do it, 6 to 10 weeks or 6 to 12 weeks, and then they have to kind of take a break and do some post-cycle therapy. That's because they're blasting their system with so much of it, versus just giving yourself the right amount to get you to optimal levels, so you don't have the side effects, you don't hear about the roid rage, etc., but you just get the benefits of it without seeing the side effects. But it is becoming more popular because think about it, as you age, your testosterone levels decline. And that's why we have lower sex drive. It's harder to put on muscle mass. We don't have that motivation and drive anymore that we did when we were in our 20s. And the goal of testosterone replacement therapy is really just to get you back to the levels of when you're in your 20s again, or your 30s. It's not really to blast you off and make you this superhuman, whatever, although you may feel that way, but it's really bringing you back 10, 20 years so you have the optimal levels again. It's just like I tell people, they're worried about becoming dependent on it, but if you're low in vitamin D, you're going to take vitamin D. If you're low in your vitamins,
good point.
Vitamins, right? So why not replace the testosterone to optimal levels as if, you're looking at it as like supplementation to optimize your well-being?
That's a good point. I think it's just a stigma, huh? It needs to be, stigma taken. Okay, talking about TRT and, stacks of different types of BPC 157 or other things to put in for peptides and stacks. What would you say the ultimate one is? Because you work a lot with the highest of high performers, like some names you probably can't even say on here, and there's Hollywood superstars. Of what are they taking? Let's say it's take me. All right, I'm getting ready for a movie, big blockbuster movie. You're like, hey, this is what you need to do. What stacks am I taking?
Okay, so without mentioning names, first of all, I think a lot of the Hollywood stars, they want that look, and I know it's competitive, and they need to get that look, that Marvel look, before a movie or performance. But here's the thing. A lot of times they're getting it from the underground, or they're getting it not through a doctor, they're getting it from the gym, et cetera, and they're trying to put on that, they want the quick results, but it's better to do it under a doctor's care and have your levels monitored throughout this journey, and not to go too high. I'd rather you start earlier in your journeys and work your way up to it versus like a quick shotgun approach where you, oh gosh, I've got to roll in, 6 weeks. I gotta look good in 6 weeks. It's better to, if it's coming up, start early and going up. Now, the stack that I think most people do is probably at least baseline some testosterone replacement therapy. That's your building block. That's your baseline. And depending on their goals, are they trying to add size? Are they trying to lean out a little bit? It's really going to depend on that, what peptides to add to stimulate growth hormones so they can look leaner. Are they trying to get bigger?
Okay, let's go both. Let's go both. What's leaner? Let's say we're trying to get a little leaner.
Okay, so leaner, I would probably go with something like maybe a little low dose of something like the Ozempic or the Mounjaro. Not too high because we don't want to impede muscle growth, right? But the testosterone therapy kind of offsets that. So leaner look, you do a little bit of the GLPs, you do some testosterone replacement therapy, maybe some CJC, 1295 to stimulate growth hormone levels, and then maybe a little bit of low dose oxandrolone, which is, street name, they call it Anavar, but just low dose, just enough to get you that hard lean look and to burn off some of that midsection fat. AOD is another one. It's good for fat loss. There's a couple other ones that are out there too, but those are the kind of ones that I see to kind of get that leaner look. And then you have the guys who want to bulk too.
Yeah, what is oxandrolone?
Oxandrolone was actually a pill that I think they took it off the market now for commercial use. So a lot of people used to use it in the ICUs for patients on the ventilators. You're in an ICU, you're in bed all day, and you're pretty much wasting away. Your muscles are wasting away. So they'd give them low dose oxandrolone pill to kind of preserve their muscles. And I believe they even used it in pediatric burn victims as well before, to make sure that they were keeping their protein synthesis, the creation of protein going, because they're losing it. When people started using it for bodybuilding purposes, especially for bikini competitions or to shred up, they would notice there's a potent steroid for fat loss and for that lean muscle look, and it adds lean hard muscle too on top of it. So it's one of those that it's oral. You don't want to go too high on it, because anything oral has to go through the liver. You don't want to tax your liver too much.
And is that kind of the reason why it's injectables versus oral, is because of the liver? You skip the liver if you're injecting? Yeah,
you do bypass most of the liver when you inject it, or if you get a pellet therapy and all that, it kind of bypasses the liver. So you're not eating something oral, and it has to go through that, what we call first pass metabolism, which can tax your liver. And that's why I see a lot of times when we check people's liver, their enzymes go up, or they tell you if you're taking anything oral not to drink while you're on it, or take other medications, because it can tax your liver quite a bit.
Man, I never knew that. I'm just, I'm learning things as we go here. A lot of things, actually. So tell me now, we got to get mass. We got to be a Thor, Aquaman. What are we doing?
Well, I don't work with a lot of people trying to put on a lot of mass, but I think what they usually do is they increase their testosterone levels by taking a higher dose of testosterone. They may do something like nandrolone, which is also called DECA. A lot of people will do that. They may take another peptide that actually stimulates hunger and bulks them up, like MK677, also known as ibutamorin. It's a potent growth hormone stimulator, but it also makes you super hungry. So guys trying to add a little mass, or guys that are real skinny and trying to add some muscle, I tell them, we can try a little low dose MK677 and kind of get you bulked up a little bit. Yeah.
I feel like I have high levels of that just regardless. I feel like that is.
Yeah, I think we all do. Yeah, right. And that's why people take the Ozempic and all that stuff to kind of blunt the effects. But this does the opposite of Ozempic. It makes you super hungry.
Man, how interesting is this? This is so cool. This is like, you just having a conversation with a mad scientist who can just, manipulate the body in so many ways.
Safely, though. Safely.
That's the thing. Yeah. Safely, right? We're not 1980s Gold's Gym, where I realized, where I just found out, like, it used to be legal. Like, these drugs in these gyms used to be legal. I was having a conversation with like an OG at Gold's Gym. Yeah. It's crazy.
Isn't that insane? And these are like actual hormones, and people had no monitoring back then. They just would, they would trust whoever's making it in their kitchen sometimes and inject it and say, I'm going to try this. It's not safe at all.
All right. Speaking of creating a genome, I don't even know if that's the right word, but it sounded cool. Brian Johnson, and we have his DNA results from gene therapy transfusions pulled up here. Muscle mass. Now, I'm short version of this. He had DNA replacement. I mean, that's not even like a thing, right? Is this like
gene therapy? I'm not too familiar with too much with gene therapy. I know they do it in other countries. I don't know if we can do that too much here, but the goal with it was to kind of reverse aging. One of the things that we need to look at as we age is we lose muscle mass. It's the reason we break our wrists. That's the reason our bones get, they kind of lose mineralization if you're not lifting as much. Keeping muscle on is so important as we age. You'd see older people that have that frail look. They're kind of hunched over.
Yeah.
They lose their muscle mass, right? So preserving muscle mass is healthy.
So, okay, let's break down some of Brian's points here. He's got, his muscle mass increased by 7%. His body weight went up 5%. Speed of aging decreased to 0.64, which is slower than 99% of 20-year-olds. That's incredible. What is follistatin? Follistatin levels increased to 160%. What is that?
Yeah, follistatin. Actually, a lot of people are starting to inject follistatin now. It's actually used to, stimulate muscle growth, and it also helps with fat loss. So it's actually a protein that tells your cells, to grow, and your muscles to grow. It actually inhibits something called myostatin. Myostatin is what tells your muscles to stop growing. You have this protein that says, hey, stop growing. So it takes out the myostatin and allows your muscles to just grow. So it really helps with promotion of that. And I think it's going to be one of those things, if they can make it correctly, it's going to be used for a lot of, I think it can be used positive for a lot of medical conditions, people that are chairs or, disabled, et cetera. It may help with them kind of stimulate muscle growth again. But I think it's kind of in the early stages. and finding a good source of it. I don't even think they have it on the market yet for that.
So we need to do that with copper. And we're killing
There
it.
you go.
We trademarked that idea. Nobody can take that. Nobody can take that.
Yeah, totally reverse aging.
And I know what you do is so important for female health, post-menopausal, obviously for females at any stage.
Yeah.
Can you talk more about your work in in that level and that world for the female aspect? I know we've been talking a lot about my own selfish questions here. But talk to me on the female work that you do in hormones and longevity.
Yeah, I think the key for helping women live healthier, live a more proactive life, and a healthier way of living and improved well-being is going to be hormone replacement. Because think about it, when you go through menopause and around late 40s, early 50s, for a lot of women, their ovaries shut down. It would be the equivalent of our testicles shutting down, right? So they lose their estrogen, they lose their testosterone, they lose their progesterone. They start having the hot flashes, the body changes, the fat comes on, they start losing their hair, libido goes down, they get the vaginal dryness, all that stuff can happen. But that's kind of the part of the aging process. But if you can replace that safely to levels that are, where they're younger again, you can really help them feel alive again. Because a lot of these ladies tell me they're having depression, they have no libido, my marriage is on the verge of, or my relationship's on the verge of breaking up. Because I have no libido, my husband, et cetera, our intimacy's gone to, it's been shot. But replacing that and giving all these, it's really empowering to women to give them these hormones back so that they can enjoy life again. And a lot of them get off antidepressants. A lot of them get off their medications. They're active again. They're going to the gym. They're actually adding muscle and noticing positive changes within their body and on their physical appearance. And so, I think it's a different world with ladies because you're kind of managing so many hormones. Men are a little easier because you're basically managing like 2 or 3 hormones, whereas women, you're managing a whole slew of hormones to kind of make sure everything's in balance.
That's fascinating. I had no idea that's what menopause was all about. I knew it was this word of like, I tried to dance around and avoid, and I knew it was a musical, but I had no idea. That's crazy. What about premenopausal? Is it still like, obviously, there's a lot more hormones, and I'm not going to act like I know anything about the female hormones. Is hormone replacement and what you do from a longevity health optimization standpoint, is that still really important for females?
It's so important. And I think the sooner you start it, the more beneficial it will be. So as soon as you start having those changes and noticing those hormone fluctuations, it's good to get a blood test and see where you're at. And to try to, I don't want to say keep you out of menopause. There's no way to avoid menopause, but we can start the hormones a little early so you don't suffer through menopause. You don't have those side effects that come with when your ovaries shut down. So it's important once you start noticing these changes, whether it's in your mid 40s, late 40s, whatever, that, go to your doctor or someone who specializes in this so they can check your hormones, see where you're at and monitor you, because you may not need all the hormones that are required for menopause. You may just need a couple or maybe just one, just to help you kind of bridge that gap and help you feel better to make that transition into menopause. And then once you hit menopause, we can always, replace it safely for you.
That's great, man. You know what? I know everybody's wondering, that's listening right now, like, hey, how can they work with you? Okay, we don't live in California. How do they work with Asandra? Everything. Just give us a breakdown on how they can reach out to you and all that.
Yeah, sure. Listen, I think it's important that you find a good longevity anti-aging physician. We can work with you telehealth too as well. We can always do it that way and remotely treat, because we can ship the medicines to pretty much all 50 states, medications. But if you prefer somebody local, it's really important that you find somebody with a reputation that understands how the hormones work, how to balance your hormones, but has been doing it for a while and understands how this works, because it's really not a one size fits all. I'm training doctors from around the country, actually from around the globe now in this. So we're expanding our network to kind of train doctors to learn these types of therapies and kind of bring it out to the masses so that people understand it more. And I think we need to get over that stigma, because you have one side of the spectrum where doctors are for this, they understand it. And then you have the old school thinking where they've been taught hormones are bad, peptides bad, hormones bad, drugs and big pharma good, right? And I really need to get over that there's other types of treatments out there that work, that are natural, that we just can't patent, because you can't patent testosterone. It's already found in your body. It's a natural hormone. So we got to get over that stigma.
Well, man, I think you're exactly right. This seems like when you think about like, hey, what's to come next? I think it is that, right? It's the education around, it's the getting over the stigma. And I think that's coming where people are getting smarter, their eyes are open. Like we've talked many times of, the big pharma and everything they're trying to just sell and keep people in this cycle of sickness. You are one of the leaders in being able to break that stigma. Man, next time I see RFK, I'm going to tell him he needs to add you to the team. You need to be on team Maha.
He needs to be my patient. I'd love to help him.
There you go. Totally.
I'd love to see RFK.
Well, how can people work with you? I think when they listen to this, like it's just so kind of you to say, hey, find someone who's smart and locally. But I mean, here's from my perspective, you're the best there is. My wife and I, we go to you for any medical question. You're probably like, dude, stop texting me these random questions. But you have the answer for all of these. And we are, we're very healthy. And it's a huge thanks to you.
Yeah, no, thank you, David. I mean, listen, follow my Instagram page. It's Asandra MD, ASANDRAMD.com, or just AsandraMD.com, or Asandra M at Asandra MD on Instagram. I do a lot of kind of educational videos where I'm talking to people like you about this and kind of trying to get over the stigmas of all this. You can contact me through there. There's a website I have as well. Happy to help. Or like I said, if you prefer to work with someone local, I can try to refer you to somebody more local in your area. There's plenty of doctors who do what I do. Like I said, you just need to make sure they're qualified and they've been doing this a while to understand how these things work, because it's quite powerful once you start this.
Okay. As we finish up here, are there any stories, any wild stories that come to your mind? Are there any, I know it's highly confidential, of course, with patient doctor. Are there any patients that have been like, hey, you can share my story, and you can totally be like, no, there's not. I work with incredibly high level people that I can't.
Right. No, my patients all generally that want me to share their story kind of all have the same results. They all tell me it's life-changing in so many ways, that you've given them their life back. You've empowered them again. You've saved their relationships and their marriage. I had a guy the other day tell me, he goes, Doc, I was on the verge of divorce. Had you not treated me with the hormones and got me feeling better, I was going to divorce my wife. These are more impactful stories to me when I hear the personal stories from your regular person than, the celebrity who's, looks great again for their role and they feel, they look younger, et cetera. I like hearing the stories from the mass of people saying that it changed their lives in a positive way, that they feel themselves again. They're able to, live again. That's really the best thing that touches me the most, versus the crazy stories of somebody getting buffed again.
So good. This goes without saying. You're one of the smartest people and just best people overall that Taylor and I know. So thank you for all you do for so many, of course us, but for so many, brother. Thank you.
Of course, brother. Thank you so much.
Dr. Chris Asandra is a hormone specialist, and I hadn't heard much of this, but him and Dr. James were talking about copper being a game changer, including energy production, iron metabolism, connective tissue synthesis, supports the immune function, nerve health. I've never really heard anybody talking about copper. Do you know much about copper and how that is
Yeah, so there's a copper-iron balance that is maintained in the body that's important. And for example, when women often go on birth control, you'll see their copper increase. If individuals see a decrease in hair, oftentimes we think about iron, but you have to measure a ceruloplasma.
Okay.
Yeah, so copper does play a role in a lot of various things in the body.
Yeah.
And one way to get copper, if you're not eating, mussels or things of that nature, is actually to drink out of a copper cup.
Really? Mm-hmm. Drink out of a copper cup? So Starbucks should probably look into doing their cups with copper.
I don't know. That might be a lot of copper.
Are those Starbucks cups terrible? Are they that? I feel like some things just get hype and they get on, the algorithm, and I see how bad, drinking out of Starbucks cups are going to kill you.
But it would make sense if we think about what copper is in for individuals. Copper is really important. Oysters have a lot of copper.
Geez, those are like an ultimate, right?
Yes.
Aphrodisiac,
That's
copper. Right. Start eating more oysters. Okay, so Dr. Asandra is also talking about peptides. And peptides, it seems like we're kind of at this juncture in peptides of people know about it. A lot of people still think it's kind of like HGH and think it's almost cheating, but it's an injectable, so it's kind of intense. What do you think?
Not always.
Not always.
You can take oral peptides.
You can.
Sure.
Do you think they're as efficacious?
Depends on what it is. Like
Well, that's
oral
good to know.
BPC.
Do you think it is?
157.
Yeah, BPC 157. That's kind of like the popular one, right?
Yeah.
That's a recovery one.
That is one for recovery. Yeah. I mean, I think that it can be if you're looking for gut effects.
Yeah. I think someone can make a lot of money if they figure out how to make the deliverable of that. As if it is pill form or there's nasal form. Anyways, peptides, which ones do you think are worth it? Like, there's so many letters with numbers, I get super confused. Like, which ones you say, like, look into this, that's worth it, that's good for you?
It's a good question. And there's not a ton of human data out there. And the first thing you have to ask yourself is, what is the outcome someone is looking for? And before an individual is going to peptides, do I think they work? Again, this is a broad term. I mean, semaglutide, Ozempic's a peptide.
Yeah. You're right.
And is that effective? Totally.
Totally.
BPC 157, Semorlin, Tesamorlin, these are all peptides. Some of them are pretty effective and others maybe not so much. MK677 seems to be something called a ghrelin agonist.
Ooh, what does that do? I've never heard of that.
Makes people very hungry, but
it makes them hungry.
Yeah, it makes people hungry.
It's a reverse Ozempic.
That's reverse. Yes, that's reverse Ozempic. Is there a role for it? I suppose the first question is figuring out what is legal nowadays versus what is not. And I believe that there is a lot of individual variation.
Yeah, I'm sure.
Some people seem to respond and others do not.
Well, what do you think about Ozempic then, that hot term? Is it, well, good is probably not the right way to ask that
Does
question.
it work? And is it safe?
Does it?
Yes and yes.
Okay.
Yeah.
It is safe.
It is.
Okay.
But I will say we have better options. So Mounjaro is another somewhat class. It's not solely a GLP-1.
Okay.
It works, I think, better. And I think the data also supports it working better. Individuals can lose more body fat, which is amazing.
Yeah.
Also seems to have less side effects, nausea and vomiting. But what I think is fascinating is the only time in medicine that we've seen this robust amount of weight loss before was bariatric surgery.
Oh, wow.
And now
Tell me about that.
individuals, so when diet drugs started, it started with desiccated thyroid. It started with thyroid medication. And then it started with something called DMP, which seemed to be very toxic to the body. And then, of course, you move into phentermine and all these various other kinds of weight loss medications. And their percentage of efficacy is anywhere between 3 and 5%. Maybe at the very most 10%, which I don't even think it's that high.
Okay.
These kind of medications are, Ozempic someone could lose 14% of their body weight.
Jeez.
And Mounjaro is even higher.
Wow. And you think they're just going to keep coming out with
There's going to be
more
multiple
companies.
generations.
It's going to be, keep getting better and better. Isn't it like Norway or is it, no. It's, what country, their whole GDP based is on Ozempic? It's one of those European countries.
So Eli Lilly is a European country. Eli Lilly is a European company.
Yeah.
And they will charge $100 for the medication. They charge Americans 10 times more.
Wow.
It would cost an American $1,000 versus in, a different country, and it's $100.
Huh. I heard someone saying that the next person running for president should make this their number one stance of just making
but it's crazy. So we're subsidizing a lot of money for large pharmaceuticals. And this is where compounding pharmacies like Empower Pharmacy, which is the largest compounder in the world, makes medications available to the public at a much lower cost.
There you go. Well, that's good to know. So no side effects.
There are side effects.
Not like long term, though.
I mean, these drugs have been around for a long time.
They've been around for a long time.
They've been around for a long time. Overall, I believe them to be very safe and effective.
Thank you so much for tuning in. And if you enjoyed this episode, there's plenty more where it came from. You can go find another episode just like it right here. Come on. You can click it. You know you want to.